it to all. I ended up, I don't know what just happened, but I ended up comparing it to all schools that I would visit. And it just, nothing could compare to how I first felt when I was at Hanover. So, and then I also wanted to play soccer and run track. So Hanover provided me with those opportunities. I majored in KIP, was supposed to minor in chemistry, but COVID happened. So, and then at Hanover, I ended up just doing track. And then I was in Black Student Union, FCA. I worked at the registrar and the shoebox. I was a peer mentor and a peer advisor. I volunteered with the football team, and I was a football office volunteer. I'm a 21st Century Scholar mentor, if any of you guys are 21st Century Scholars. And then I was in Tri Beta and Alpha Lambda Delta. Some classes that I was especially interested in, and I think that really helped me in my didactic year of PA school, were anatomy and phys. And then, of course, I had any Stanford class, so exercise physiology for sure. I think that those all helped a lot. You get the unique opportunity at Hanover to do a cadaver lab in anatomy. I think you guys still do that. And so that helps prepare you guys, especially if you choose the PA route and you choose to go to IU. We do a cadaver lab, and it's just nice to have that experience of already having been in a cadaver lab, and it helps a lot with your anatomy. Things I wish I would have been more involved in, kind of like Riley said, do anything that you can that offers you experience in the medical field. What I found is a lot of my classmates in PA school took a gap year, did things during their undergrad that got them a substantial amount of medical experience. And I do wish that I had more medical experience going into PA school. So anything you can take advantage of it, do it now, especially while you're in undergrad. And it'll look so good, when you guys decide to apply to grad school and anywhere. And so what I'm doing now, I'm at IU, at the IU School of Health Sciences. So I'm downtown at IUPUI, and I'm studying physician assistant studies. So I'll get my master's in physician assistant studies in August. And then I'm currently on clinical rotations. I'm on my first day. Today's my first day of my sixth rotation. So I'm on community medicine now.
Right. Gosh, in a nutshell, you guys were both highly involved, just had a lot of balls in the air all the time, and somehow had the grades to get where you're at. That's awesome. I'd like you to just both take a bit of time and talk about your profession. Taylor, maybe we think we understand physician assistant a little bit more, but talk about the pieces to your job. And I think I'll start with you, Riley, simply because maybe CAA might be a little bit, not as well understood, but just talk about the profession. What does an anesthesiologist assistant do?
So the first time that I even found out what an anesthesiologist assistant was my senior year, after I'd already put in applications to medical school. IU's anesthesiologist assistant program happened to come to the career fair and set up a table right next to IU School of Medicine's table. So
and it was Dr. Mitchell, right? Dr.
Yeah.
Sally Mitchell.
Yep. Yeah. So she's an alumni here, so
Yep.
at Hanover. So I kind of also made the connection thanks to Joyce. She introduced us, and we started talking, and I had no idea really what being an anesthesiologist assistant was, and I knew what being a PA was, and I didn't think it'd be the best fit for me. And I really liked anesthesia, so I thought I would go the MD route, but I always loved the idea about PA school, about being in that more teamwork environment and, working a little bit more collaboratively and, having a little bit shorter schooling. So I was really intrigued with anesthesiologist assistant on how that would work. So to kind of give you an overview of what I learned is that you work in an anesthesia care team. So it'll be myself and an anesthesiologist, and that anesthesiologist could be overseeing up to 4 rooms having surgery. So he might be working with me and potentially 2 or 3 other coworkers. So how that works is I go and talk to the patients for whatever case we're going to be doing. And then I'll kind of go through their history, tell them like what I plan on doing for the anesthesia. and then the anesthesiologist will come in at the end, agree with the plan. We'll meet back in the room, and together we both put the patient to sleep. So I might, in anesthesia, and sure with COVID, you've heard about people being intubated and things. So that's pretty commonplace for a lot of general anesthesia for big surgeries. So I might be intubating them after he pushes the medications, or he might intubate and I push medications, but we kind of delegate how we're going to work together. But we put the patient to sleep together. Once the patient is asleep and stable, the anesthesiologist will then leave the room. I'll maintain the case, give any medications like pain meds, and just keep them under anesthesia, support all their vital signs. And then when the case is finishing up, I'll let the anesthesiologist know, and he'll come back at the end and we'll wake them up together. So take the tube out, make sure they wake up fine. Just do that whole process, and then I'll take them over to recovery and they'll wake up over there. So there's more autonomy than I originally thought, which was great. I wasn't sure if I was going to be, have an anesthesiologist with me the entire time, but it's actually a really nice balance of, you have some support at the most dangerous, kind of scary, adrenaline pumping parts of the case. Going off to sleep, you give someone too much medication, you can really drop their blood pressure, slow their heart rate down. So, and some people are just really fragile. I mean, I've put to sleep someone that was like 98 years old, and I've also put to sleep a 2-month-old baby. So having someone else with you at that time, I really appreciated that. I think if I was an anesthesiologist and was by myself, that could be a little bit more stressful. So yeah, that's kind of the daily routine. So working all through the patients, and but you do a lot of different kinds of cases, which the diversity is great. Anesthesiologist assistants aren't limited in what kind of cases they can do. You can place nerve blocks. So I've done a labor and delivery rotation. So I've done people's epidurals and spinals for C-sections. So that's really rewarding to have someone that's laboring in a lot of pain, and they're just super uncomfortable. And then you get an epidural in for them, and they're just like, oh my gosh, I can breathe. And then you step out, and then you know that they're going to have their child, and it's a really cool experience.
While I have you, do you want to talk about what your work schedule will be? Is it a Monday to Friday kind of thing?
So a lot of different hospitals kind of do things differently. But typically what I really liked about AA school was, and just the career field, was that you have really good work-life balance. I have a really nice schedule that I set up in Muncie. I'll be working Tuesday, Wednesday, Thursday. So I'll have a 4-day weekend every week. And I'll be doing 13-hour shifts. So I start at 6 in the morning and I go home at 7. And that's really, really nice. So I'll get to start the day out, do the bulk of my cases, and then help kind of finish on add-ons at the end of the day. So, if you're just in the middle of the day, somebody breaks their arm and needs to get a surgery, that kind of stuff comes up onto the board, and it's not been scheduled. So, you have a full OR board of people who've got their surgery scheduled to get their gallbladders out and things like that. But inevitably random things kind of pop up throughout the day. So by doing this schedule, I could help my hospital finish out those kind of random cases that seem to trickle in that need to get done. So they had a situation that worked really well for me to get a little bit more work-life balance and just do 3 days of work. Most people do 4 10-hour shifts at the hospitals around Indiana, because I've rotated down in New Albany's hospital and a lot of the hospitals in Indianapolis. So you'll typically do 4 10-hour shifts. So 7 a.m. to 5 p.m. is the most common. And it's pretty uncommon to have a 5-day work week.
Okay. All right. Interesting. Okay. So Taylor, I know that you are not in the profession yet, but if you could just talk about the different pieces, the different opportunities. I know there's opportunity to specialize, etc. So just have a bit of a chat about PA.
Yeah, so kind of like Riley, I had no clue what a PA was until Dr. Jax, he was my advisor. He told me what a PA was, and he said, I think this would be good for you. So yeah, and that's where I ended up. So a little bit about what a PA does. We examine patients, treat patients, diagnose patients. Pretty much people compare it to like a miniature med school, an accelerated medical school. Our curriculum is very similar. And then we do 1 didactic year one clinical year. And so it is accelerated compared to like a traditional medical school route. But yeah, we examine, diagnose, treat patients, can assist in surgeries, perform procedures, interpret different lab results. And then there's different opportunities to specialize. And that's why I think I like the PA field so much. It's just versatile in what you can do. You know, you can pretty much be in any field of medicine that you want to be. You can do surgery, you can do outpatient medicine in the clinic, you can do just solely inpatient medicine. The only thing you can't do is anesthesiology. So, but other than that, yeah, you can pretty much do anything in medicine. A typical day in the didactic life for me was, you know, waking up, kind of preparing for class before I got to class. Our classes are all on Zoom, so preparing for class, then going to class like 8 to 5, taking a little bit of a break, and then studying probably like 7 to like midnight every day. So if that just gives you a little bit of how, you know, it's a rigorous field, it's a rigorous career path. So, and then for my clinical schedule, it just depends on what clinical you're rotating on. Right now I'm in community medicine, so it's a pretty much like a primary care office. I'm there 7 to 7:30 every day. My last rotation was peds, so it just depended. I was doing inpatient at Riley, and then I was doing newborn. So it really just depends clinical year wise. And same goes for picking your specialty and what you end up doing as a PA. That really determines what your schedule is like. I know emergency med is all shift work, no calls. So, you know, you do a 12-hour shift and then you're not on call. You just go home and you don't have to worry about anything. Whereas a lot of inpatient services, you're on call. Like I did a rotation at the burn unit, and the PAs there were had to take call for so many hours per week.
Can you talk just a little bit, Taylor, about what it looks like to specialize? Is that something that happens after you are certified?
Yeah. So in our program, we at the end of our traditional clinical year, we get the opportunity to have 2 electives, and that's generally when you choose. Like for me, I'll probably do an elective in peds and an elective in women's health because those are the 2 things I think I want to specialize in. It's fairly easy to specialize, and a lot of PAs, the PA profession was really built for primary care and helping to take some of that load off physicians in primary care, but actually a lot of PAs specialize. And so it's just dependent on where you want to work, whether it be like a gynecology, oncology office, cardiothoracic surgery. Those requirements will be pretty dependent on where you want to work. But that being said, a lot of specialties take new grads. Whereas like places like urgent care and primary care and family med, they want you to have a little bit more experience. So it really is dependent, but actually it's fairly easy to specialize as a PA.
Okay. I want to ask, and here you aren't truly delved into the profession yet, but what would you say are some of the favorite things? What's your favorite thing about your career, and what are things that you recognize even right now that are maybe not your favorite things, maybe more challenges? No career is perfect, right?
Yeah. Definitely, like I already mentioned, the versatility, as well as I forgot to touch on this, but what you do as a PA, it's collaborative with the physician. And I think people sometimes get confused about what it looks like to truly collaborate with a physician. And so, you know, it's not like you're the collaborating physicians over your shoulder, you know, like checking everything you do. You actually get quite a bit of autonomy, and then you staff all of your cases with a physician, and that physician can be remote, they can be in the office with you, and they're really there as a resource for you to ask questions, to talk about treatment options, things like that. So it's a very collaborative, and so I think I really like that aspect of the PA field because you get to work with the team and really feel like you're supported. I don't think that I've asked any PA and they've ever said that they don't feel like, you know, like they have support from their physician, or they feel unprepared, or they feel like they can't do something because they have that support from their team and as well as the physician. So I think I like that aspect. I also like how versatile it is. Like I mentioned before, you know, you can be delivering babies one day, you know, with working like in an OBGYN office, and the next day you can decide that you want to do cardiothoracic surgery, and then you can, you know, switch specialties and specialize in something like that. So I really like that aspect of the PA field as well. A con I think of being a PA is trying to get people to understand the role of a PA. And Riley probably experiences this too, just like what your role as, you know, an anesthesiology assistant, a physician assistant is. And so having that conversation with patients and trying to talk to them and allow them to understand, you know, what your role in their healthcare on the healthcare team is with them. I think that's one of my least favorite, one of the hardest parts of being in this field.
Okay, that's interesting. Riley, how would you answer that two-part question?
Yeah, I would definitely agree with Taylor. Like, if you're going to consider going into be a mid-level provider, I think there's a lot of pros, and it's a really, really good environment to be in. I think the job market is really strong. There's less schooling. You get to do a lot more than you think you're going to. So it's not like you're really micromanaged, like Taylor said. But yeah, talking with your patients and kind of communicating with them, like, this is that I'm an anesthesiologist assistant and I'm going to be helping out. You know, you have to not be obsessed with the title of being like a doctor. And you can't let like people get under your skin, because you are highly trained once you finish school and you are competent to take care of the patients. But you'll get, you know, you'll get like an older gentleman or someone that'll be like, I think I need a doctor to do my care, or I don't want the assistant, I want the doctor. Or you look really young, are you a nurse? And it's just, you can't let it get to you. And that's like the hardest part of every day. But I think confidence comes with it as well. The more bedside manner you get, the more you talk to patients, the more polished you come across, the more confidence you have. Like probably 2 months ago, right before I graduated, I had like this patient that was kind of being a little grumpy about the whole thing. And one of the things I really like about being an anesthesiologist assistant is all of like the hand skills, we call it. So like intubating, IVs, arterial lines, placing central lines, big IVs for transfusing blood and surgeries. I like that stuff a lot, and I practice it a lot. So I'm pretty good, especially for how little training I have in being basically a new grad. And I had this guy that everyone was missing all these IVs on, and I went and got an ultrasound, and he was like, no, I need a doctor to place this. And I was like, I have a lot of experience with this, don't worry. And I threw it in, and then he was like, oh, wow. And was like, this guy, he's really pretty good. And the nurses were like, yes, that's what we were trying to tell you. Like, we couldn't get it. We asked him to come in, and then you're looking at him like, this guy's 25. He doesn't know what he's doing. And they're like, no, he does this in the OR all the time. But yeah, it's balanced to be a mid-level, but I think especially anesthesiologist assistant, there's so many things you get to do. That collaborative environment, yeah, they're not the physicians, especially once they get to know you and have a relationship with you. Like, I know all the anesthesiologists I work with at my hospital, and the more they get to know you, the more they trust you. So you'll say, I think that these medications are the best for this patient, or I feel more comfortable using these medications. And they might be like, oh, I would typically use something else, but you'll be in here for most of the case, and I trust you, that's a good idea, but I'd maybe make this suggestion. And like, actually, that's a good point, let's do that. So you kind of find a plan. So I take a lot of pride also in my outcomes with the end of the case. So, trying to make someone wake up as comfortably as possible, and try to have it just look very smooth, so that they're not coughing when they're waking up and you're taking out a breathing tube, and just trying to make every little thing go as smooth as possible is really, really nice. And, very quickly doing some of those things, like getting a special line in an artery so you can see beat to beat blood pressure. When you can do all that stuff really well, it makes you look really good in the room, and it's a lot of fun.
As someone who is, a little bit older than the demographic in this room, I can identify with like saying, oh my gosh, they look so young.
Yeah.
But I think you're absolutely right that the more experience you gain, the more confidence you gain. That's huge, that confidence and that professionality. Good, good. Any questions from the audience? Anybody have something pop up along the way? We'll open it up in a little bit, but can you guys talk a little bit, Taylor in particular? I know that lots of PA programs do have a requirement for direct patient contact hours. I don't believe IU's program has a set number, but can you talk to us and tell us, did you gain some? And if so, how did you do that? I know there's various ways to get those hours. Can you talk about that a little bit?
Yeah, so one of IU's mission statements was to promote diversity and inclusivity within their upcoming classes, including my class. So I think that's why they took away some of the hard requirements for entering into PA school. But I will say, I think at the very least, most of the students had 500 to 750 patient care hours, if not much more than that. I know people with thousands of patient care hours. So I think that minimum of 500 is probably a good number. As an undergrad student, I did medical scribing through Scribe America. So I scribed at the emergency room at Columbus.
Okay.
So yeah, that was fun. You know, I got to learn a lot of medical language. I got to be in an emergency room. I got to see so many different things. So that was fun.
So did you do that over summers, or
I did.
remind me, did you take a gap year or?
I did not know. Yeah, I did it over a couple of summers, and then also while I was at Hanover. It was an hour drive, and it was like right in the middle of Indianapolis and Hanover. So
that's a tricky one. I know, because scribing, sometimes you get so many hours. We've known students in the past that have scribed and it's negatively impacted their grades just because of that commitment. So it's a very much a balancing act.
Yeah, I will say, I know that a lot of professors at Hanover were kind of discouraging scribing around Madison. And I will say, I tried to transfer to Madison, and I don't think that it fit in with my school schedule. And I think that I wasn't able to prioritize being a student first, being in Madison, trying to be a scribe.
Well, we shall see, because we're under the Norton umbrella now, and I'm not sure what that means for our future, but okay. Talk about like your values, if you both took a look at those, and just maybe the one or two that really jumped out at you, and to the point that how does it intersect with your decision to become a physician assistant and an anesthesiologist assistant? Riley, you want to address that?
Yeah. So the two things that I think really stood out to me was freedom. I love science. I love healthcare, but I didn't want to eat, sleep, and breathe healthcare and not really have a life outside of healthcare. I really wanted to prioritize my family and things like that and have work be work. So finding a career that had set hours, and like a lot of the anesthesiologist assistant jobs in the state don't have call and they don't have weekends. So I had a set schedule, and I knew that I might be 30 minutes late if they're really understaffed and they can't get me out of a room until it finishes or something like that. But I wasn't going to have these crazy days that, and I wasn't always going to be away from home. Growing up, my mom was a pediatric nurse and she worked lots of hours, and if she was behind on charting, like she'd get home at like 10 p.m. So I was not seeing them a lot, and I didn't want to go do that exact same kind of thing. So that was important to me, and I've been really happy with the schedule that I was able to get. And then another thing that was really important to me, not in the typical way, but I said diversity because I wanted to do a diverse amount of things. I didn't want to just do one specialty and do the same thing every single day, day in, day out. Even if it's cardiac cases, it might be the same 4 kind of cases a lot. So for me, the diversity was really nice with anesthesia. It made it hard for school because you have to learn so many things, and each specialty is so nuanced on how you have to do the anesthesia for like a bowel case versus how you do the anesthesia for a C-section versus you know, a lung surgery. All that stuff is different. But at the same time, it made it very interesting when on Monday you're doing colonoscopies, and then Tuesday you're doing neuro cases on someone's spine, and you have them upside down for 12 hours and you just have one patient. Like the longest spine case I did was I think like 14 hours. And by the end of the day, I was like handing off to a different doctor because I wasn't over. So you just get a lot of variation, which kept it interesting throughout school. And I think is going to make it continue to be interesting for my career, just to have a bunch of stuff that I'm doing. Yeah.
Taylor.
So I had a couple of the same as Riley, but a couple that were different. One of my top values is responsibility. I think that's one of my top values because I think it's always been rewarding for me to have, to be responsible for something. I feel like I just always get something out of having responsibilities. And I think that it's a privilege to be a part of somebody's healthcare and to be able to, you know, treat people and really make a difference in their health. And so I think responsibility was one of my top values for that reason. Just having that responsibility is just so gratifying to me. And then compassion and empathy. I think those are really important, especially for patient interaction, listening to patients. You know, every patient is different, and you have to be able to like really listen and try to connect with the patient on that level. And, you know, two patients can have the same disease and they don't get treated the same way. And that's just because medicine is very much patient dependent. I think you have to be compassionate and empathetic to be able to recognize that and be able to have a meaningful relationship with your patient.
Okay, good. Keeping my antenna up if anybody has any questions at any point along the way. Definitely possible. Okay, let's just jump right to kind of strengths, which I think you've sort of touched on, but if there's something that's significantly different, things that you realize, oh my gosh, like I'm so glad I did this and kind of developed and grew in this way because this career really requires this particular strength. Riley, does something in particular jump out at you?
Yeah, I looked through some of the lists, and I think especially with anesthesia, a big one is having a calm demeanor when you're talking to patients, you know, explaining what you're going to be doing, in that confidence in what you're doing. But another thing is being calm and cool and collected in the operating room. Anesthesia is typically who leads codes. So if the patient does start to deteriorate, you're in charge. And even if internally, you know, all the fire alarms are going off and you are very, very nervous and stressed, even though you've had all this training, it's not a common thing for someone to have, you know, codes don't happen that often. So you kind of have to rely on your training and have that stress management as well, and just stay calm, because if you're acting irrationally, everyone's looking to you for your advice and what needs to be done. So it just can kind of get a little disheveled, but
Picking out, not welcome.
Yeah,
Right.
you get that through experience, and you get that
Yeah.
through working with people. I've worked with one doctor. I had a code happen about 4 months ago, and I was in a cath lab, and we were just doing it was supposed to be just a super simple case, which is when stuff always goes wrong, is when it's supposed to be just super simple. And even the anesthesiologist was like, you are about to graduate, you're doing great. I'm just going to step out to use the bathroom real quick. And I was like, yeah, I'm comfortable with that if the surgeon's comfortable. And he steps out, and I just started noticing gradually with what they were doing that on the EKG, some of the symbols started to, the trend started to be that there might be a heart attack kind of impending, and that the heart was under a lot of stress. So I called him and said he needed to get back in, notified the surgeon that there was a problem kind of arising, and pretty much the doctor came back in, was like, yeah, you're correct. And then within like 2 minutes, the patient had a full-blown heart attack on the table, and we had to code. But this doctor was just like, okay, it's time for this. And I'm like, oh my gosh, we're doing compressions, we're trying to move stuff out of the way, the surgeon's trying to, get better access to the heart and get better blood flow through these clogged vessels. And he's just like, okay, it's time for this now. And that just actually calmed me down so much more too, because I knew what we needed to be doing. And just to see that he was like, yeah, we just go through the steps and that's what we do. And that experience and working with a good team kind of helps you with your stress management. So if you go into the healthcare field and everything kind of seems a little bit overwhelming, like that's normal, and you get your calm and your cool and collectedness with just experience and comfort level. So it just takes time.
Good insight there. And incidentally, I think Dr. Sally Mitchell is very calm. She just has a very cool, collected. So that's interesting.
Yeah.
Taylor, strengths that you identified.
So one of my top strengths was stress management as well. So that's good that you touched on that, right? I think another one of my strengths was motivation, kind of the ability to remotivate yourself in times that you're feeling overwhelmed, burnt out, super stressed out. And I think trying to refocus as to why I'm in the PA program, like why I'm doing this, and just finding those little sources of motivation for me have been instrumental in PA school, because at times you can just feel super overwhelmed, super burned out. You're overtaking exams, you're going to your rotation every day and working 12 hours and then having to come home and study. So just finding ways to remotivate yourself, whether be taking a break, giving yourself motivation while you're studying, giving yourself rewards while you're studying, just little things that you can do to really motivate yourself to get through the program, because once it's all said and done, it's beyond worth it.
That's good stuff. I mean, it's very applicable right now, even, to keep yourself motivated at this stage in the game. I'm officially going to open it up and ask for questions from the audience. Alex.
I was looking for Riley. What would you say is kind of the benefits of becoming anesthesiology assistant versus an actual anesthesiologist? And if you become an anesthesiologist assistant, you kind of get into that profession, and then maybe down the road you want to actually become an anesthesiologist if that's possible, or I guess it's kind of two questions.
Yeah, I could hear that. So some of the differences, I think an important distinction would be to talk about time. So after graduation from Hanover, if you were to get into AA school versus medical school, AA school is 28 months. And then right now I'm in this leeway period that takes about 2 months for you to get your license. So effectively, after graduating from Hanover, having a little bit of a summer break, within 30 months you're working, and the salary is very, very good for an anesthesiologist assistant. And then you have a better schedule. The anesthesiologists, especially it seems to be a very in-demand specialty. That's why the market's so good for anesthesiologist assistants right now in the state. A lot of anesthesiologists are pulling a lot of extra hours, taking a lot of call. I know one of the things at my hospital was a lot of the anesthesiologists weren't getting what they call post-call days off. So if they worked, let's say Tuesday, and they were on call Tuesday night, up through 7 a.m., and then they had a real crazy night and they worked till 7 a.m., but they were still scheduled on Wednesday, they would have to come in and work Wednesday. So effectively that could be a 36, 48-hour shift if they ended up working. And that's something that can just happen. And that's more common with residency, to pull longer shifts and stuff like that. But to then be a full-blown anesthesiologist, and with a kind of the difficult market to get enough providers and the increased demand with COVID, some of their hours are pretty crazy, where I'm coming in with a nice set schedule, and by working late, they are really happy to have me on the team, because I'm going to be helping clear off some of those late running cases, so that hopefully for their call, they get to go to sleep instead of having to work all through the night. and then for the timing with an anesthesiologist, you have medical school, which is 4 years. So you do your 4 years of school. First two are pretty didactic, and then the second 2 years of medical school, you kind of start to see more of your specialty rotations. Then after that, the anesthesia residency, you kind of do an intern year, where a lot of people do like internal medicine or kind of just some general kind of cases, but then 3 years of specific anesthesia residency. And the hours for being a resident are very intense. AA students work with residents a lot. So how IU paired up in the operating room a lot of times would be I would work with a resident and the resident would also be working with a doctor. So it was almost like two of us were working under one person, and it was kind of, we'd divide it up and be like, hey, do you want to do this? Do you want to do that? But I got to know a lot of the residents really, really well. And I got to talk to them. But I remember one of the craziest things to me was when I was on OB, and I said, I love OB. This is great. I help out with these blocks and I get to work with these patients. And they were like, yeah, OB is great for you guys because you guys get to go home at 5 p.m. They're like, we consistently have to take 24-hour plus shifts on OB. And it's constant phone calls, especially at like Eskenazi, where there's just so many patients and all those patients need to be seen, and there's just not enough providers. So it was pretty hectic and crazy, and you know, they're more burnt out than I was feeling. And by the end of AA school, I was like, oh my gosh, I don't know how I would have done medical school on top of that. If I then, for your second question, wanted to be an anesthesiologist at the end, I'm very happy with the balance of what I get to do, especially for the income. But if I wanted to go back, I've got a lot of clinical experience, a lot of healthcare experience, and I have great grades to show that at like a medical school level education, I was keeping up and doing well. So I'm sure I could get back into IU's medical school, but then I'd have to do the 4 years of medical school and then 4 years of residency just to then be working again. So it'd be a pretty long process. And I think if you make the decision on if you want more work-life balance or if you want a little bit more pay and a little bit more recognition and autonomy, you kind of have to go between those two. So if you're really thinking anesthesia is for you, I'd highly recommend shadowing an anesthesiologist and seeing in a situation where they maybe don't work in care team what they do. And then shadowing like an anesthesiologist assistant or a certified nurse anesthetist to see kind of how being a mid-level doing anesthesia works. And I didn't shadow an AA, I only shadowed an anesthesiologist. So I was kind of going in a little bit unsure, but then actually doing the profession. It's been, I think, a much better fit, and my wife is much happier that I'm going to be having the hours I am, and that when I get to come home, I kind of get to turn my brain off instead of being constantly like on call and ready to go.
Okay. Wow, that's compelling. A side note, the Medical Scholars does have an anesthesiology rotation at this time, so that's pretty cool. And I'm in communication with Christopher Guarliardo from IUAA, and so students that are interested, I'm able to potentially hook you up so that you're able to find some shadowing opportunities. So good question. What about others? Lily? No, that was a mess. Anybody else? Yeah.
Yeah, I have a question for Taylor. I know you're in your second year, your clinical year, doing rotations. Can you talk about a little bit about like the transition from didactic and learning the stuff in the classroom to actually like applying it that way? Did you feel well prepared for that? Just talk a little bit about that.
Yeah, that's a really good question. So didactic was 15 months. And the curriculum, there was a lot in the curriculum. And then we did like a clinical med course, which went over, you know, like gastroenterology, cardio, all of those different little anatomical divisions in the body we went over. So the transition from didactic to clinical, you're definitely very nervous transitioning, but we do a preclinical week before we go to clinicals, and it's full of doing procedures like you know, inserting IVs on each other, doing phlebotomy on each other, doing some fake simulation cases at Fairbanks, which is a simulation center we have downtown, that's functions as a simulation hospital. It's very legit. So, and then you do some OSCEs, which are fake patient counters that you get graded on, with a standardized patient who is an actor and knows how you're supposed to be performing as an didactic year student. Um, so we do like a clinical week that really helps prepare you for clinicals. And then once you get to clinicals, so my first rotation was women's health, and I was super nervous, not knowing what to expect. But your preceptor has a good idea where you are in clinicals. Whether you're on your first rotation or your 12th rotation, the expectations are different. And so each preceptor has a good idea about that. And knowledge wise, you know more than you think you know, especially like when you actually get into situations where you're seeing patients on your own, and you're having to, you know, examine them, come up with a differential diagnosis, diagnose and treat the patient. You know way more than you know, but there's also resources available for you. They don't set you up to fail. So I felt very well prepared for clinicals, and I'm on number 6 right now, and I feel like I'm exactly where I'm supposed to be.
Awesome. Any other questions? Yeah.
This is for Taylor. I was just wondering, like, what is the hardest part of the application process, or like what do the schools like value the most with that? There could be different parts of it.
So hardest part of the application process for PA school?
Okay. Hardest part. So I did my application through CASPA. I believe that they still do applications through.
Yes.
Yeah, okay. And it's a common application. So I would say the hardest part of the application process is probably getting everything in a good amount of time so CASPA can authenticate your application and make sure that you have everything. So they have to certify your application and say that your application's all good. And that can take anywhere from 2 weeks to, you know, a month and a half. So you really want to get your stuff in early for that aspect, because PA schools won't look at you unless your application is certified by CASPA. So I think that was one of the hardest parts. Other hard parts were ensuring that you got adequate recommendation letters. A lot of PA schools want you to have a recommendation letter from a PA. And so if you don't ever have a relationship with a PA, you know, you never shadow a PA, you're never with a PA, it makes it kind of hard to get those recommendation letter requirements from a PA. So that's why I kind of recommend starting early and shadowing as much as you can, getting as much experience as you can, and developing relationships with people who are, you know, medical professionals, so they can write you a really good recommendation letter.
Incidentally, Taylor, we have started a certified nursing prep course over our May term that's available to any pre-health students. I developed it with pre-PA students in mind, gaining those kind of hours and that clinical experience, but also pre-nursing. We've had pre-med, pre-OT, and so on. Any other questions? Justice, do you have a question? No? Okay. And you've done an anesthesiology rotation, correct? Or are you doing it? Yeah. Justice Thurman is doing the externship. Anybody else? Got some good questions here. Is there anything else, and you guys have really touched on this a lot, but anything else that you can say to these students that would help them to either sort of confirm or sort of reject a career path while they're here before they've, you know, committed any time or treasure to any program? What are the things that would help them to just really be sure, whether it's between, you know, several careers or one career that they're considering in particular? Riley, do you have thoughts about that?
One thing that I think really helped me solidify like anesthesiologist assistant was what I enjoyed at Hanover, because anesthesia, if you're going to simplify it, it's really complex. There's a lot of nuance. If anyone wants to learn more about it or talk to me more specifically about anesthesia stuff, I'd be happy to meet with anybody. But if you want to simplify kind of concepts that you're learning at Hanover that would apply, I really liked physiology. I liked some of like the cell and molecular biology stuff and biochemistry that was kind of like structure and function, because anesthesia is a lot of pharmacology, and pharmacology, at the sense that you have to understand it for anesthesia, is kind of like a little bit of organic chemistry without all the crazy arrow pushing mechanisms and stuff that is really tough. I thought organic was really hard, but it's like concepts that I understood well. So it's kind of like how biology ties in with organic chemistry and physiology, and how that all kind of meshes together. And those are the things that I enjoyed at Hanover. So then when you're taking care of a patient and you start to see like, oh, their blood pressure is low, it's like, okay, I can fix that by using this medication because it affects the physiology in a certain way. And it's like, so I found that kind of stuff to be really interesting. And then working in anesthesia, I enjoyed that a lot. And another thing I think to consider is practically, I had to look at, job markets and student loan debt. So you've got undergrad student loan debt, then you're going to take on a master's degree. So or a medical degree, making sure that your degree and kind of your indebtedness works out well with how easy it's going to be to get a job and how that job is going to pay. So you have a realistic plan on how to kind of get yourself out of that hole. So just to give you a little quick glimpse of the anesthesia assistant market in Indiana, my class had 100% job placement rate, and it's pretty much 100% placement across the country from what but IU specifically in Indiana, I had signed a job offer 6 months before I even graduated. Because you do clinical rotations, so you get to know these staff and you get to know the hospital and they get to see you. So every clinical rotation is effectively a job interview. And then at the end, they can say like, wow, we really were impressed with you. Do you like how we do things here? And I interviewed with, I think, 4 different hospital systems. And, but yeah, I had a signed job offer 6 months before graduating, and everyone in my class had jobs. So it's something to consider, because it's that realistic thing that you don't always think about, but you leave with a lot of student loan debt and you need to address, and finding a job is very important. So I was worried about not knowing about anesthesiologist assistant, like what's the market like, and it's very good.
What a nicely adult answer. Thank you. Quickly, Taylor, is there anything that you would say, yeah, you really should be doing this, just to tease it out and know for sure?
Yeah, so I think one of my last tips would be when you do go and shadow and you're around healthcare professionals, ask them questions, just ask them to be honest with you. And just ask them like questions you genuinely want to know about. When I was trying to decide what I wanted to do, med school versus PA school, I had shadowed several doctors and kind of told them like my background story, what I was considering, whether it be PA or med school. And a lot of them told me they wish they would have done PA school, and just giving their insight as to why they wish they would have chose PA school. So ask questions and don't be afraid to ask questions, especially when you're shadowing. Just really take advantage of the opportunity there that you have.
That's really good advice. We've got time for maybe like one more question. If somebody's got something that's been hanging on your head all night. No? One more minute, second. Okay, well, Justice.
This one's for Riley. With BNC, are you restricted to where you can practice?
Good question.
Yeah, that's a great question. So yes, CAAs can't practice in every state currently. There's legislative efforts to practice in more states that kind of go about every year. The big kind of pickle is just like adult issues with politics and lobbying. So CAA is very similar to nurse anesthetist, which is just kind of a similar, you become a nurse first, and then you go to CRNA school, and then we have basically the exact same scope of practice, but since it's 2 different jobs, basically that can do the same thing. There's just like legal lobbying with politicians on which states that kind of restrict the expansion a little bit. But it expands every year. We get new places to work. I think like Kansas just opened up. If that has a lot of draw to you, it doesn't to me. But you can work, it's worth looking at a map, but it's a lot of like the East Coast, like the Carolinas, Georgia, Florida. That's kind of where it originally started. The Midwest, so Indiana, Ohio, Michigan. You can work if you're into being like out west, Colorado, you can work. You can work in New Mexico. I actually rotated in Albuquerque for a month and like lived up in Albuquerque, Santa Fe area and really liked it out there, and you can work out there. So you have a lot of options. I think it's 13 states, and
I think it's up to 17 now.
is it? Okay. Yeah,
so.
it's definitely growing. The demand's there. Wyoming's trying to open up right now. And then as far as hospitals go, it's depending on which hospitals run care team, but there's so many, like in Indiana especially, and it goes up every year. Like I rotated in Fort Wayne and got a job offer there. I rotated in New Albany, great group down there. If you're local to Southern Indiana, I loved it down there. I almost took a job there. 4 hospitals in Indianapolis. Like you could work at Riley Children's if you love pediatrics. It wasn't for me to at least specialize it in. And then Eskenazi if you want trauma and burns, Methodist and University, and then a few other hospitals as well, like Muncie, Valparaiso. So you can go pretty much anywhere in the state and quite a few other states as well. And if you are interested in that, I can kind of reach out and figure out where you can look at, especially if you have a specific area that you're trying to find. I can help you out with that.
Really good question. Yeah, good one. So if students have something that they'd like to talk with you about, are you open to maybe having a email conversation with students after the fact? We'll talk about it. Let me know.
I'd be happy to do that. I've done a Zoom call with past students as well.
Yeah.
And I helped a previous AA Hanover student that was thinking about it after she was doing a gap year. I helped her kind of like know what to do, and actually helped her get in, and she's at IU's AA program now.
Yeah, that's awesome. So these guys are the experts, and that's what's exciting about hearing what you guys have to say. Well, I'm going to officially close, but if there are those of you that want to come up to the desk and talk, do you guys have another 5 minutes in you? Okay, excellent. Well, thank you. Official. Appreciate you guys. So
as everybody's walking out, I'll give just a couple of tips that I have.
okay.
Just being at Hanover, take advantage of the Career Center and the mock interviews. Margaret Krantz is amazing at that. She has a log of a bunch of questions that professional students donate after their interviews to like her question bank, and she'll ask you questions that more than likely will be in your interview. So take advantage of mock interviews for sure. And then just develop those relationships with, your professors, develop them with people you shadow with, do that so you can have great, solid recommendation letters. And then just work on, developing the strengths that we kind of talked about, Riley talked about today.
You guys think that you developed those kinds of things like just confidence, leadership, just through all the involvement that you were a part of? You guys were a part of a lot of organizations.
Yeah, I think it helps. I would also say like, don't get over involved. I think that was one thing that hurt me. I think it was my sophomore year. I really started just trying to do too much. That was like the year I was in charge of the rugby team. I became an RA, and I was doing two study groups, and I tried to start scribing that year too. And my grades like started slipping, and I even it came up in my interview with IU. They said like, why are your grades bad this year on especially like physics? And then why did you get an A in physics 2 if you did poorly in physics 1? And I had to talk about, things that are going on.
So get involved, but not too over involved. I'm going to put these on the table on the edge here. If you guys want to take these are QR codes to these helpful sites. Do you guys have more questions, or you just want to hear them talk. I know that we've got folks in the room that really are very interested in each of these pathways. And I don't want to rush you out the door, but I also want to give you opportunity. So why don't we still have it that if you've got a question, why don't you come on forward and we'll do it that way.
Hey, Taylor, did Mike Yard do your anatomy lab?
It was Dr. McNulty.
Oh, okay. Yeah. Because I was like, we went to the cadaver lab and I was on IU's campus downtown as well. So did a lot of stuff at Fairbanks in the simulation center. So I was like, oh yeah, we probably had the same people.
I can't believe you're an anesthesiology assistant already.
Yeah.
Looking at the little flyer that Joyce had made for us, and I was like, how is, I mean, I knew when I asked you about it, you're like, yeah, we hit the ground running, like we're already learning how to intubate and stuff. And I was like,
yeah,
crazy. So
yeah, it was they definitely, as far as clinical, like you get started very quickly.
Hey, can you see Casey here? Here, when I think if you stand over on the other side.
Yeah, we can see where people are exiting. Here we go.
That's
Yes,
now go around that side where the I need to shut up. Okay. If you start talking,
I can see them at the top.
Okay, I just have a question for Riley. How did like your undergrad course load like kind of look like being a biochem major in a tech lab?
Yeah, it was pretty intense. I think if I was to redo it, I don't know if I would have done the biochemistry major. I loved biochemistry, but it just like required a lot of additional classes. And I mainly started to go down that route because I thought it would just hit a lot of requirements, and I had a little bit of unsureness on what I wanted to do. If I wanted to be MD, PA was kind of what I was between. So it hit like a lot of those requirements for both schools. So especially if you're younger, like look at the prereqs for MD, PA, AA, and make sure you're hitting them, but also kind of get your plan earlier than me. But I think it definitely overloaded it a little bit. I think there were times that I was doing like 3 lab-based classes in one semester. Wow. So it was, yeah, Dr. Cunningham was like, Riley, I would not approve the schedule on anyone else, but I know you can handle it. You're just going to hate it. And I was like, yeah, I know. I probably shouldn't have gotten myself into this situation in the first place, but.
So Casey's declaring soon, right? And what are you considering?
I'm between like maybe biochemistry or chem or biology. I'm not really sure yet.
And you're also looking at both these careers. She's looking between these two.
I would say that if I was to redo it, I would probably have been a KIT major and just focused a lot more on the actual physiology and taken the prereqs and taken the biochemistry classes, but maybe have just done like a chem minor, a bio minor or something like that. I think one thing you have to think about is like, I started taking things just to hit requirements and just to, I thought the biochemistry degree sounded better, but the title doesn't really matter at the end of the day. It's your knowledge and your enjoyment. And I think if I took more like KIT classes and physiology classes, I performed better in those. My GPA would have been higher, and I think my enjoyment would have been higher as well. So that's just something I probably would have redone. I don't think anyone looks down on a physiology minor or a major for going into healthcare.
Right.
Thank you. That was super helpful.
Did you have a specific question?
Yeah.
Yeah, this one.
I can see you.
I have a question more for Taylor. I think I'm leaning more, well, I think I'm like pretty much deciding the DA. I got like a lot of the websites for like admissions are like really unclear about like the specific like type of experience they want. So like based on the people who you have like been in classes with and stuff, what did they do? Because like I'm a junior now and I've worked at a hospital all summer as a tech, and I've done probably like 30-ish hours of shadowing between like a NICU PA and then I would shadow with like a peds like neurosurgeon. So like if I keep kind of going on that path, do you think that is like
Patient B? I wish I would have been a tech. I think that that's perfect what you're doing. I was actually going to recommend that a lot of people should be a tech if you can, if you have the time for it. You learn a lot of hands-on skills that you'll be able to show off during clinical year. You'll be able to teach people different things, you know, like doing EKGs, you know, anything like that, where you can help, and especially help teach other students. Our professors love that. And being a patient care tech is amazing for getting your patient care experience. I think that's perfect.
Awesome.
And I think that you already have an adequate number of hours for shadowing. So keep going.
Follow-up question on that. So
Mhm.
do you like, I kind of hate where I work as a tech, but so like, do you think it's like, what'd you say?
Are you at KDH?
No, I'm from Indy, so I'm at like the Community North Rehab Hospital because I immediately wanted to apply and they're the only ones that responded to me, so I could work over the summer. So do you think it's like a good idea to have like experience in like a lot of different areas, or do you think like me having that one job and then shadowing different specialties, like what is like the trick?
Yeah, I think that that is just fine. I think that if you don't love where you're a tech at and you want to get a new job somewhere else, I think that's perfectly fine. But I also think it's fine to stay in one area. One thing that when I was doing my applications and interviews, I was really passionate about underserved areas and working in underserved areas. So if you have anything that you're particularly passionate about that you would want to put in your, you know, your application, you want to talk about in your interview, you can say like, yeah, I worked here, you know, in this, you know, federally health qualified center. And I really want to work in healthcare shortage areas. That's why I worked there. And I got a lot of experience, you know, dealing with that patient population. I think like finding something that you're passionate about that you maybe want to pursue in PA school and having the experience behind it, I think it looks great on your application.
I was thinking about getting a job at Riley.
Yeah. And if you're passionate about, you know, like the pediatric population, I think that in your interview saying that I was a patient care tech here, and then I decided that like I'm really passionate about working with peds population. So I decided to be a patient care tech here. I think that our faculty in particular will love that. I know they would.
If you're thinking about Riley and you can get in there and like you're thinking about pediatrics, I think it's really important to experience that, because if I did pediatrics, I'd be a third generation pediatric like hospital person. My grandpa was a pediatrician. My mom's a peds nurse at Community North, and she used to be at Riley. So I love kids. I was like, this is going to be great. And I made sure I was going to shadow at Riley. I had 2 rotations there. And for me, seeing like the sick kids and having to do anesthesia for children, like I just realized like that was not the environment for me, which was really important, because going into AA school, I was thinking like, I'm going to do pediatric anesthesia. And I'm not saying that peds are bad. Like my mom loves pediatric cases and I like kids, but man, it was just like doing it and seeing it. I was like, this is not the environment for me. I'll still do a pediatric case when it comes up, but didn't want to specialize in it. So getting that exposure early definitely is not a bad idea.
Yeah, I was the exact opposite. I was like, I'm not gonna like peds, and
Yeah.
I love it.
Mhm.
So, yep.
You don't know till you go, I guess.
Mhm.
No, you really don't.
Good questions. Thanks for coming, guys.
Thank you.
Yeah, absolutely.
Okay.
We're totally happy to help.
Thank you to you too. Really wonderful to see you guys. Best of luck to you, Taylor, as you finish up and as you start your new job, Riley. That's
Yeah,
so
thank you
exciting.
so much. Yeah, Taylor, keep pushing. It's tough, but you got it.
If any of them have questions they want
Tell
to
him.
ask,
I said, Riley told Jordan that Adrian said hi.
Yeah.
I've been on like MDC for like 3 years. So I've worked with Jordan a lot.
Yeah. Jordan, my wife is still an advisor for Theta, so I get to keep wrapped in a little bit.
Nice.
So yeah.
All right. All right. Well, thank you. Thank you for your time
Absolutely.
tonight.
Yeah, send
Appreciate you
anybody our
both.
way.
All right.
Bye.
Best wishes. See ya.